Hello everyone, my name's Megan, one of your hygienists at Precision Dental Center. I'm here today with a periodontal specialist, Dr. Hajar,
Good morning.
and his hygienist, Janet, to talk a little bit about gum recession. So gum recession is a common issue or concern a lot of patients have, to where the gum wears away, exposing more of your root, which can increase sensitivity to cold, and also it can increase your risk for development of cavities. So we have Janet here today to talk a little bit more about recession.
Hello there. There are a lot of different causes of gum recession, so I'm just going to talk briefly of those causes. So first, we call it a mechanical abrasion, which could be caused by incorrect toothbrushing technique. Another is abfraction, which is caused by malocclusion or incorrect bite. Another is an orthodontic movement, or cause from orthodontic movement when a person wears braces, and it could cause some gum recession. Another is also a different type of cause where some people could put smokeless tobacco, and there's caused by friction. And then the last thing is the periodontal disease, or caused by bacteria. And then I will give it to Dr. Hajar to talk to you about how we treat these problems.
Good morning, how are you? Dr. Hajar, and it's been a pleasure to meet Megan today. She came from a Precision Dental Group, Dr. Balin office, and Dr. Mark. Both doctors are excellent. They've been working with me for a long time. So just I would like to go over briefly regarding the treatment plan when it comes to the gingival recession. So it could be using two techniques. One technique called free gingival graft, used for a root coverage. So this is obviously, it's a very common, it's a lower interior. We see it a lot of my practice. Patient being referred here for evaluation of a gingival recession. And as you can see, it could be like Janet said, it could be few etiology. It can cause the problems. So the way we treat the lower interior, we use called free gingival graft, and we go to the roof of the mouth. We take a piece of the gingiva and we augment it around this area, and we use a few sutures in here. By doing that, we will have a very nice root coverage. We increasing the thickness of the gingiva and preventing any more gingival recession happening in the future. The other technique we use called connective tissue graft. It's used for a root coverage, and it's very common. It's used for the upper maxilla area, and we see it due to a trauma from brushing, and we see a gingival recession. The way we do it, we make small incision around the neck of the tooth. We flap the area. We go to the roof of the mouth, and sometimes we just basically release the gingiva very loose and trying to bring the gingiva way more down in order to use the root coverage for this area. And this is before the surgery, and this is after the surgery, and this is 2 weeks post-op, 1 year, nice and stable, no inflammation, stay there for many, many years. So every patient, asking what would be the post-op. The post-op, normally after the surgery, the patient is going to be a little sore for that day. We provide them with the pain medication, mouthwash. They use it 2 times a day. And we place little dressing to protect the area. We follow the patients on a weekly basis, first couple of times, after that bi-weekly. And it will be sore for a few days. They'll be able to go back, return to the work the next day. And when the healing is completed, usually we send back the patient back to his referring dentist. Most of the time, since a patient comes for this kind of procedure, it's only does not require in the future anymore post-op at my office, only as needed.
Well, thank you so much for listening, everyone, and thank you for speaking with me today. But if you guys have any further questions or concerns, please call us at Precision Dental Center or with Dr. Renarian Hajar, the best. Thank you, everybody. Have a great day.
Thank you.